In this section, we're going to be talking about drugs commonly used to fight TB, as well as other mycobacterial diseases. So before we get into the individual drugs, I'm just going to talk about in general, what drugs you'd give for each condition. And the way that I remember this is just the acronym RIPE, RAISE, DRC. And RAISE is not spelled the right way, but RIPE, RAISE, and DRC. So for TB, we're going to give RIPE, and RIPE stands for rifampin, isoniazid, pyrazinamide, and ethambutol. And if you notice here, I have the I like that. I have the I in asterisk, and that's because this is used for prophylaxis. So isoniazid by itself can be used for prophylaxis for Mycobacterium tuberculosis. So all I have to remember is that RIPE. So rifampin, isoniazid, pyrazinamide, and ethambutol. And the next one is Mycobacterium avium complex, and I think the most common way you'd see this is in an HIV patient with a CD4 count under 50, and they usually don't get pulmonary symptoms, but you can get other symptoms along with that. And for this, I just have the acronym RAISE. RAISE stands for rifampin, azithromycin, streptomycin, and ethambutol. Okay, so let me do one more time. So rifampin, azithromycin, streptomycin, and ethambutol. And if you notice here, I also have stars over the A, and that's because azithromycin is actually the prophylaxis for Mycobacterium avium complex. So if you see a vignette and you see red snappers, you see something's acid fast, and their HIV patient, everything points, and the first thing you really think of is Mycobacterium tuberculosis when you're thinking acid fast. But also keep in mind MAC complex, which isn't going to have pulmonary symptoms. The CD4 count has to be under 50, and then that prophylaxis is going to be azithromycin. So that's something to keep in mind. The final one that we have is Mycobacterium leprae. This is the one that causes leprosy, and this one I just have the acronym DRC. I don't know. I just think of I don't really know. DRC, just say it over and over again, I guess. But just remember RIPE, RAISE, DRC, and the DRC stands for dapsone, rifampin, and clofazimine. Clofazimine. So just remember that. So dapsone, rifampin, clofazimine. Just review tuberculosis. This is rifampin, isoniazid, pyrazinamide, and ethambutol. And isoniazid is prophylaxis. For MAC complex, we're going to give rifampin, azithromycin, streptomycin, and ethambutol. And azithromycin is going to be the prophylaxis. And finally, for Mycobacterium leprae, we're going to have DRC, which stands for dapsone, rifampin, clofazimine. So now let's go into the individual drugs. The first drug we're going to be talking about is isoniazid, or INH, and the mechanism of action is decreased synthesis of mycolic acids. Just recall that the mycobacterial cell wall is made up of mycolic acids, so it's decreased synthesis of these mycolic acid, which eventually lead to cell death, or mycobacterial death, sorry. And so this is done through Kachi-independent inhibition of INHA. And so here's the idea, is that you have INH, which is actually a prodrug, okay, and it has to be metabolized by the Mycobacterium into INH, the active metabolite, which I'll call INH prime. Then this INH prime will go on to inhibit the enzyme INHA, which is involved in mycolic acid synthesis. INHA stands for enol acyl carrier protein reductase, but that's not really important. Just know that it blocks INHA, which is responsible for mycolic acid synthesis. The interesting thing about INH is that it can be used for solo prophylaxis against TB. If you remember in my acronym from before, RIPE, remember that I was starred, and that's because it can be used in solo prophylaxis against TB. And that's pretty important. So another thing to know is that the toxicity, the isoniazid's toxicity, is that it injures neurons and hepatocytes, and there's actually an acronym here, I and H, so that if that helps you remember it. And how it does that toxicity, I'll get into in a moment. But just know that the final toxicity you have to know about isoniazid is that it can cause drug-induced lupus. And the way I remember this is I just remember all the drugs that have lupus, and just remember the acronym. It's not HIP, I guess, to have lupus, and then that's hydralazine, isoniazid, procainamide, and phenytoin. And so if you just remember that, you just know that isoniazid is part of that. So I'll go back for a second for the toxicity. So the reason it injures neurons is that isoniazid looks like B6. So what it actually does is it increases the excretion of B6. So you actually have a B6 deficiency. So you need to give B6 along with isoniazid because it can leach B6 away from your body. And if you'll recall, B6 is used for GABA metabolism. And so since you don't have that GABA metabolism, that can actually injure neurons. The way that it can affect hepatocytes is actually not through B6. It's actually because isoniazid is metabolized, it's actually acetylated, and it turns into ammonium. And ammonium is very hepatotoxic and can cause hepatitis. And this leads me to another point in which that there are fast and slow acetylators, and this is important to know for isoniazid. So there are fast acetylators and there's slow acetylators, okay? So if you're a fast acetylator, then you're going to acetylate that INH really quickly, and you're going to create a lot of ammonium. Okay, so fast acelerators actually have a higher chance of getting hepatitis because you're making that Imodium, because you're acetylating. And that's something to keep in mind. So if you're a fast acetylator, you have a higher chance of hepatitis. But remember, if you're fast, you're also going to have a shorter half-life because you're acetylating, because you're deactivating it really quickly. On the other side, if you're a slow acetylator, okay, you don't have that hepatitis, okay, because I guess your ammonium, I mean, you're still going to be making it all eventually, but it's very slowly made in your liver, so it's not going to be as hepatotoxic. However, you are going to have a high half-life, so the neurotoxic effects of isoniazid or the B6 leaching effects and all that stuff will be increased. So just keep in mind, if you're fast acetylator, you have a shorter half-life, but you do have increased risk of hepatitis, and if you're a slow acetylator, then you have a lower risk of hepatitis, but you do have a higher half-life, so higher chance for other toxic effects of INH to hurt you. And that is it for INH. The next drug we're going to be talking about is rifampin. There's a lot of R's in this drug, so just keep that in mind. The way that it works is by blocking the DNA-dependent RNA polymerase, and as you can kind of think, the DNA-dependent RNA polymerase is used in a lot of other bacteria. A lot of other bacteria use this enzyme, so it doesn't just work for TB, it works for a lot of other stuff. But in terms of a TB drug, resistance can be used if you use it by itself. So you want to be using multiple drugs so that you don't get some resistant strain to pop up. And so here's another R, so resistance of solo. Another thing is that it can also be used in leprosy. Remember I had DRC, dapsone, rifampin, and clofazimine? And so you're going to be giving the dapsone. And if you give rifampin along with dapsone, then it's actually going to delay resistance to dapsone. So know that if you use it by itself in TB, you'll get resistance really quickly. And in leprosy, you want to add it to dapsone also, because if you add it to dapsone, then you'll delay the time to resistance. Next, it can be used for prophylaxis for both Neisseria meningitidis and Haemophilus influenza. Remember, these are both organisms that can cause meningitis, so just know it's prophylaxis for these two organisms. The other thing you have to know about it is that it induces the P450 system. And actually, here's an R here if you think about it as revved up. So it induces or revs up the P450 system, and it has a minor hepatotoxicity. And really the most high-yield thing about rifampin is that it causes red or orange body fluids, and that's not really a problem. It doesn't cause any symptoms or anything like that, except that they have red orange body fluids. So that's something that you have to tell the patients that's there. So red orange body fluids, never forget that. And if you actually kind of remember, here's another R. So here's all the R's. So rifampin. So let's just do a quick review. Rifampin inhibits the DNA-dependent RNA polymerase. There's another R. TB, resistance if used with solo, and leprosy delays resistance if you use it with dapsone. It's used for prophylaxis against Neisseria meningitidis and Haemophilus influenza for prophylaxis, and induces or revs up the P450 system with minor hepatotoxicity and causes red or orange body fluids. The next drug we're going to be talking about is pyrazinamide. The way that this works is that it inhibits mycolic acid production, and there's two ways that it might be able to do this, and it's either by blocking the fatty acid synthase 1 or breaking apart the membrane. They're not really sure which one it is, but it's either one of those, so just keep both of those in mind because both of those might show up. It can either block FAS1 or just do the membrane directly. So this is really important to know. So pyrazinamide, okay, it turns into its active ingredient, which is actually pyrazinoic acid. We'll call it PYR prime, and for that it requires the enzyme pyrazinamidase, okay, which is pretty easy to remember. But the biggest thing to remember about this is that this enzyme is activated in an acidic environment, okay? The acid is what activates pyrazinamidase, and that is what activates the active ingredient. So this drug can only be used in an acid environment. This is important because it's effective for the intracellular mycobacterium. So if a macrophage, if you have your macrophage and your TB, and it's being it's being engulfed by this macrophage, when it tries respiratory burst on that, that's going to be an acidic environment. So pyrazinamide works only in acidic places because it activates that enzyme, which activates pyrazinamide into its active ingredient, pyrazinoic acid. And I state that in the text right here. In terms of toxicity, you just have to remember it's hyperuricemia and hepatotoxicity. The last two enzymes we also talked about isoniazid and rifampin. They also had hepatotoxicity. So, I mean, there is hepatotoxicity in this one. There's not in the next one, though, so keep that in mind. And hyperuricemia is also there. The final drug we're going to be talking about is ethambutol. This works by blocking arabinosyl transferase. And here's the idea. In the mycolic cell wall, you have these things called arabinogalactans, okay? And the mycolic acids attached to this, okay? So you know mycolic acids are part of the cell wall, and they attach to arabinoglycans. Well, arabino transferase, arabinoacyltransferase, is what makes those arabinogalactans. So if you don't have this enzyme, then you're not going to be able to make the arabinogalactans, and you're not going to be able to attach mycolic acid, and that will cause death of TB. And one of the most high-yield things about this is that it causes optic neuropathy, okay? And it can cause retinitis and cause red-green color blindness. This is very important. So we had two colors here. Remember, rifampin caused the red-orange color to the body fluids, and ethambutol causes red-green color blindness. So I always joke around, if you were on rifampin and ethambutol at the same time, would you think that your body secretions are green? I don't know. That's a way that I kind of remember that they kind of have different effects. And that's pretty much everything you need to know about ethambutol. Okay, well, let's do a quick review of all the drugs really quickly. First thing I remember I talked about was RIPE-RAISE DRC for TB, MAC, and leprosy. Remember, TB, RIPE stands for rifampin, isoniazid, pyrazinamide, and ethambutol. We went over all these drugs in this section. And remember, the I is special because it can be used for solo prophylaxis against TB. The next one is RAISE. Remember, this stands for rifampin, azithromycin, streptomycin, and ethambutol. The A here stands for azithromycin. Remember, azithromycin is the prophylaxis for MAC. And remember that you want to get that prophylaxis when the CD4 count is under 50. And leprosy used DRC, which stands for dapsone, rifampin, and clofazimide. The first drug we talked about was isoniazid. Remember, it uses CatG to turn to its active metabolite, which goes on to inhibit INHA, and INHA is what creates the mycolic acids. Okay, so that's important to know. Remember, you can also think INH stands for injures neurons and hepatocytes, and the way it injures neurons is by decreasing B6, which decreases GABA, which can cause neurotoxicity and seizures. And the way that it affects hepatotoxicity is by creating ammonium, and this ammonium is created after acetylation. So remember, if you're fast acetylator, you'll get a lot of ammonium, you'll cause hepatotoxicity. However, if you're a slow acetylator, then you'll have increased isoniazid in your blood, and you can get B6 toxicity. Toxicity from a deficiency in B6. And finally, remember, this is one of the drugs that causes lupus, and that's important to know for INH as well. The next one we're going to talk about is rifampin. Remember, it inhibits the DNA-dependent RNA polymerase. We also have R standing for resistance if used alone. We use alone in TB. We also have the R because it revs up the CYP450 system. We also have an R because it causes red-orange discoloration of fluids. We also have another R because used with dapsone. Remember, it decreases the time that you have resistance. And remember, it's also used for meningitis, for meningococcal meningitis, or from Haemophilus influenza. The next one is pyrazinamide, and remember, this works either by just affecting fatty acid synthase 1 or just breaking apart the membrane. They're not really sure, but just know that a low pH, hydrogen ions are required to activate the enzyme which activates the active ingredient of pyrazinamide. So remember, you need this, and where do you have that low pH? That's right, in the lysosomes of the phagocytes. So after they eat the phagocytes, it's that acidic pH which is really going to activate that enzyme which activates this into its active ingredient. The other drugs are good at killing it extracellularly, but pyrazinamide is the one that's particular for intracellular killing. And the toxicity for this is hypouricemia and hepatotoxicity. So it is contraindicated in gout, for example. Well, I guess if you have TB, it's a bigger deal. But I'm not really sure. And the final one that we're going to talk about is ethambutol. And remember, this works by blocking arabinoacyltransferase. And this is what makes arabinogalactans. And remember, the mycolic acid is what attaches to that. So if you don't have the arabinogalactans, you don't have the mycolic acids, and you don't have a cell wall. And the biggest toxicity to remember with this is that it causes optic neuropathy or red-green color blindness, okay? So let me just draw that here. So red-green color blindness is important for ethambutol. And again, remember, you have rifampin over here, which is causing the orange discoloration of body fluids, and you have ethambutol, which is causing that red-green color blindness. Red-green color blindness, sorry. And that is it for all of the TB drugs.